Hello, my name is Sydney Pollard, and I am going to do my presentation of underserved areas on Ashe County, North Carolina. Underserved area, Ashe County, North Carolina. This presentation is by Sydney Pollard for the Practice in Underserved Areas class. So the first thing that we need to discuss regarding Ashe County, North Carolina is if it is considered rural. In the textbooks, Daly states rural communities can be identified by three separate aspects, including absolute, relative, or social cultural. On page 11 in the textbook, Daly states the absolute method to determine a rural community depends on numbers of residents, population density, distance from a metropolitan area, or type of economy. This is the most frequently used method to determine if a community is rural or not. The U.S. Census Bureau defines a rural area as having a population of less than 2,500 people and being non-adjacent to an urban area. Although the U.S. Office of Management and Budgets defines a rural community, one does not include a core metropolitan area or a metropolitan area between 10,000 to 50,000 people. The relative definition is defined on page 13 in the textbook by Daly. He states that this definition focuses on population density. An urban area has more people per square mile, but a rural area will have less people per square mile. Low population density can mean higher costs per unit of service for social welfare and less services available. And then moving on to the third approach to define a rural community is the social cultural definition, which Daly states on page 15 in the textbook. It evaluates a community in the terms of its economy, sense of identity, and types of social interaction within the community. According to these definitions, Ashe County is considered a rural community, and the next few slides will show you why. Beginning with the demographics of Ashe County, I will just read off of these slides as these are facts. The state in which Ashe County is located is North Carolina. The land area is 426 miles, and the population for the entire county is roughly 27,802 people. Although this can sound like a lot of people for an area, 426 miles is pretty high to contain this many people. There are 12 zip codes, which include the three cities: Jefferson, which has around 1,600 people, West Jefferson, which is around 1,300 people, and Lansing, which is 128 people, and these are the most prominent cities within Ashe County. The average household income is around $58,000. The poverty rate is 14.12%, and there are around 1,500 veterans in Ashe County. Further demographics state that regarding employment, labor force population, employment rate is 51.2% and unemployment rate is 5.1%. Language, 95.02% speak English, and the other population speak another language, Spanish or Asian, and Pacific Island language. The next section is regarding race. The majority of Ashe County is white. There are, and the least percent is Native Hawaiian or Pacific Islander. And the last slide regarding demographics, which could relate to social work, is regarding crime. The violent crime is 15.1, while the U.S. average is around 22.7. and the property crime is pretty high at 52.3, and the average is 35.4. And then regarding religious beliefs, less than half are considered religious in Ashe County, with the most prominent being Baptist religion, and the least prominent that is recorded is Pentecostal. These are just some facts about the community that I know from living there and growing up in this community. I have already highlighted the central location of Ashe County, which is considered West Jefferson, which is in this area. And the entire circulation that I have circled in black is roughly the outline of the county. Our closest county is, or our closest like metropolitan areas is either Winston-Salem or Johnson City. There's only one high school and one middle school in the entire county of Ashe. There are 3 elementary schools, Blue Ridge, Westwood, and Mountain View Elementary. There's one local hospital, which is Ashe Memorial Hospital, and Ashe is roughly about 30 minutes from Boone, an hour and a half from Johnson City, and an hour and a half from Winston-Salem. And it's approximately 40 miles off of I-81. And just for measurement, my parents still live in West Jefferson, and I live in Abingdon, Virginia, and it takes about an hour and a half to get there, while the majority of it is taking the exit off of I-81 and following back roads until I get to their house. So it is pretty rural. There's a Walmart and a McDonald's, known restaurants. There are a few other chain like fast food restaurants, but there are no like chain sit-down restaurants or any other chain stores. And there's one urgent care located in Ashe County that just recently opened within the past year. So most of the services that people get, they will either go to Boone, or they could even go to Wilkesboro, which is right here. Okay, so moving along to available services in Ashe County. Daymark Recovery Services is the only mental health service provider in the county. Mountain Town Dental is the only dentist in the county which accepts Medicaid. Ashe County Transportation Services will not transport out of county, so if there are services that clients need to get to, they cannot use the transportation services available. There is a Children's Advocacy Center which assists with child welfare, which is linked to Ashe County Department of Social Services. DSS also helps with food and nutrition, APS, CPS, and other child welfare services. Ashe Really Cares provides food and clothing. Ashe Outreach is one of the only food banks located within the county. Ashe County Sharing Center is a nonprofit food and supply service, and the only homeless shelter in the county is Hope Through a Vision. The barriers throughout Ashe County that are discussed on this page are from a social worker who has worked with Ashe County DSS for going on 8 years now. I was able to interview her about this project and just kind of get an inside scoop as to what those barriers are working there, since I have never actually practiced social work in this county. But she reports that the largest barrier she has to overcome while serving the county is the lack of resources. Even the services that are provided usually have limited availability or a long waiting list. There's only one mental health provider, which is Daymark, but there are not other services including anger management, play therapy, parenting classes, or other support groups. ABA is not offered in the county, which is applied behavioral analysis. Like I had said before, the one dentist which accepts Medicaid has over a 6-month waiting period for new clients or new patients. She reported that there are hardly any foster care placements throughout the county, no inpatient services or transportation offered to transport out of the county to access other services. Regarding transportation, she reported that she has to drive parents on her caseload to receive services to regain the custody of their children out of the community, and most of the children she has placed in foster care are located outside of the county as well. She reported while working in child welfare, another barrier is the culture in the county. If a child is reported for child abuse for receiving a spanking, she made this comment that most of the residents there will say that that's just the way things are, that's the way Ashe County is, that's the way that I grew up or was raised. So she has had to overcome that. And one that is a lack of resources, but also a cultural issue, is there is limited translation services, and the immigrant rate is higher in Ashe County just due to the Christmas tree business. So she reported that there is some barriers with that. She only has access to online translation services, which can be hard to request, especially when there's not a lot of phone service, or it's just it's not accessible where she's at or where she's working. And then the other barrier that she mainly pointed out was the high caseload and multiple roles that she has to play. She reported that she juggles several different roles while working at DSS. She carries around 20 to 40 cases at a time, but these cases include CPS, foster care, licensure, and adoption cases. The barriers that social workers have to face while working in a rural community lead to higher rates of burnout and turnover. So according to Ashe County Source, social services is one of the lowest paying jobs in Ashe County. Students who have learned about rural social work in the Appalachian area are underexposed to the geographic areas and different ethnic and religious groups, which can hinder the knowledge when working with minority groups or diverse cultures within a rural community, especially if they didn't grow up there. Another thing that can lead to burnout and turnover is, like I said before, with the social worker who is currently working in Ashe County. She is multitasking different roles, and she has little resources or service providers to help her clients. Like I said before, low income, and there are not honest job expectations. So I put this in there because sometimes whenever you go as a social worker, you go interview for a job, the expectations of the job may not be 100% clear. So you get in there, you start working the job, and you're just not really aware of what the expectations are. You're not aware that you're multitasking several roles, the high caseload, the commute, like she had mentioned, she has to drive out of county most of the time to get these services or transport parents, or even see the kids that are placed out of the county. So that could lead to a high rate of turnover. Brown and other authors reported that burnout results in depersonalization and compassion fatigue, which adversely affects client interactions and relationships. Another excerpt from Barth and other authors from 2008 states findings from some of these studies suggest that employees in rural settings who were most satisfied with their position experienced less burnout and or had longer tenures, had previous connections to a rural environment, so they were raised in a small town, have family in the community of the practice, or sought out higher education or completed a practicum in a rural area. So that just means that, you know, if you aren't exposed to a rural community and you just go work in one, you may you just don't understand the culture, and you don't have that education that's needed, and that can lead to a higher rate of burnout or turnover. So the best practice for working in a town like Ashe County, or in a rural community, Horn states on page 8 of his article, it is necessary that social workers are educated, trained, and supervised by competent and prepared professionals. And then also providing culturally competent work in a rural community will be very important for a social worker practicing. Page 66 in Daly's textbook states, rural communities often comprise people with a distinct common language, values, customs, music, art, and skills that are in many respects different from those of people who do not consider themselves rural. So social workers in this community should learn these aspects regarding the community that they are working in. In Ashe County, the common language is English, but there are some Southern terms and phrases that a social worker would benefit from learning that are not in the common language spoken. Ashe County is also part of the Bible Belt. So Christian or Baptist values and beliefs are normally the common belief throughout the county. It would also benefit the social worker to strive for social, economic, and environmental justice while working in a rural community by engaging local community leaders to encourage equality among race, health, economics, and etc., while the services are provided within the community. Daly states on page 322, develop knowledge and skills in less common areas of practice that involve financial literacy, microfinance, and community development would be beneficial on an economic level. And most of these social, economic, and environmental justices need to be addressed on a macro level. So that means going up to the community leaders, helping make decisions, writing grants, so that there's more funding throughout the town for these services would be the most beneficial. And then another way that Daly in his textbook reports would be beneficial for the rural community and a social worker is to practice the down-home model. The down-home model is explained as a social worker who involves different social systems throughout the community, a person and environment perspective, strengths, and problem solving. This will help the social worker provide individualized care to each client and base their care plan around their specific needs and strengths. It is based on the epitome of social work by meeting the clients where they are while involving the services that are available within the small community. Continuing ways to provide best practice within a rural community or within Ashe County is for, of course, the social worker to follow the NASW Code of Ethics, especially sections 1.06 and 1.07. Small towns such as Ashe County are known to be home to people who know everyone else, especially in this day and age when social media has to be considered. As stated before, Ashe County has one high school, limited businesses, and although there are some tourists, there are not a lot of people who really relocate to Ashe County. So most of the time, if you live there, there's a high probability that you were born there, raised there, and stayed there. So Code 1.06 talks about conflicts of interest. This needs to be considered in this environment, especially since there is a high chance of knowing your client personally, maybe by a family friend, going to high school with them, or from social media. The social worker in this instance will need to consider strict boundaries and learn to navigate this issue before it arises. Code 1.07 talks about confidentiality, which is another concern that may arise and will most likely fall hand in hand with Code 1.06. Confidentiality is something that needs to be highly considered when providing care in a small town, even as something as simple as knowing the type of car your client drives. That probably means that other people in the community know what kind of vehicle they drive. And if someone sees them parked outside of your business of practice, then it is known that they are receiving services there. Also, if group sessions are provided, most of the individuals in the group will personally know others. Being prepared for this issue before it happens will need to be considered for the social worker. And then the last thing that may be beneficial for a social worker practicing in a rural community such as Ashe County is considering telehealth services. So, according to Said from this article from 2011, a growing body of literature now suggests that the use of telepsychiatry is to provide mental health services has the potential to mitigate workforce shortages in remote and underserved areas. He also states that, according to his study, there is high patient satisfaction, improved patient convenience, improved patient compliance with therapy, a higher attendance rate, and improved continuity of care. The last slide on this article, or on this presentation, is my references. Thank you.